Good morning. Today again we are back to our study zone, nosodes and the sarcodes. As we have already learned that sarcodes are from the healthy tissues and nosodes are from the diseased tissue. So what is the difference when you think about the nosodes? That means it is a disease product, or you also have the imaginations that it contains something which has been that normal tissue has been deranged. That means the normal tissue has been captured or it has been occupied by some other. But when you think about the sarcode medicines, sarcodes as it represents the healthy tissue or the normal tissue, natural tissue, then definitely it must have the characteristic feature of the representing symptoms related to the natural phenomena of the human life. What is the natural phenomena related to our life? That is the constituent value, the strength that you can find when you think about the sarcodes. And when you think that the patient is more deteriorated, at that time the nosodes are related because almost all part of the body is captured by the disease force, or it has been covered by the disease force. But if there are some healthy, some strength, because in a diseased persons we have the two phenomena. One, the things, or one, the force type of the force which is representing as a strength for survival of the patient, and other, the diseased parts, that is representing as a weakness, and where other type of the enemies are trying to enter your life. So between, it is a struggle between the disease and the vital principle that we have to deal with. And when we think that, so in a patient you can find both type of the symptoms, the disease symptoms as well as the natural symptoms. And natural symptoms means which is the constituent part of the life, which is eternal in nature, and if that is not changed, that is the most important factor for the life. So within this phenomena, we have studied both the nosodes, type of the nosodes and the sarcodes that are available in our Metra Medica. And on these imaginations also, today we are trying to learn about the another sarcode medicines, that is pituitrine. Let me share the slides. So this is pituitrine. It is from the pituitary glands. Now, while I try to tell you about the pituitary medicines, and if you try to search in your Metra Medica, the different literatures, there are very little informations are available. So on based on those little informations, and based on the anatomical and physiological functioning of the pituitary, I have tried to find out many more symptoms that you can utilize. You can have a better utilization and understanding for this medicine. So when we think about the sarcode medicines, it is also important that we have to know the exact meaning of the tissue which is related to your life, as well as its function and its anatomical structure. This will give you a very deep insight into the different phenomena that you may have the symptoms, and it will make you to understand the symptoms in a perfect way. Now, hormones. Uh, Usually, we do not respect hormone, and we think about them as a chemical. But these are magical little molecules which do much more than that. Much more. It is not simply a chemical. It is not simply a things that you can see along with the other substance that is available, but it has got the magical power. Yes, I can say the magical power, because it has the power to concentrate, to change the state of your life, your mood of the life, your physiological functions of the life. It has been very beautifully, you can see the soul and its relationship to the pineal and the pituitary glands. Pituitary gland was the master glands. It regulates the glands of the entire body. But but the pituitary needs to be take its order for them somewhere. Through meditation, the pineal glands secretes the creates secretes and creates a golden cord with the pituitary. This in turn causes the pituitary to function in such a way that the entire body comes into the harmony with the soul. Then person can begin the process of self-control. In essence, gaining the ability to live is to live the true or authentic life. So when you are leading, you have a meditations, or when you know, live with yourself, your pituitary hormones are very much active, and they are they are controlling the strength of your life. They are controlling the whole power of the life. So it is a self-control and essence that is you get the pituitary. So that's why what we say, and all our sages and the gurus, they have tried to advocate and tried to make us understand the importance of the meditations, the importance of the having a dhyana and thinking about and living, knowing yourself, who you are, and when you try to live, you will understand your limitations, and you will have the less tension in your life. And when you have less tension in the life, your life becomes more harmonious and more essential. The pituitary is a small pea-sized gland. It is found in the base of the brain, in line with the top of the nose. That's you can understand that just is above the nose, it is behind. Pituitary act as our body master gland. It tells other glands in our body to do what to do. And this pituitary gland is also known as hypophysis, located in the base of your brain below the hypothalamus. It sits on its own little chamber under your brain known as sella turica. It is a part of your endocrine system and is in charge of making several essential hormones. Pituitary gland also tells other hormone system gland to release the hormone. So it is the master, it is the leader, it is the whole thing. It is the leader of the all other hormones, and it is hormones from that comes out from the pituitary glands are adenocorticotropic hormone, that is known as the ACTH or corticotropin, plays a role in how your body responds to the stress. It stimulates your adrenal glands to produce cortisol, that is the stress hormone, which has many functions, including regulating metabolism, maintaining blood pressure, regulating blood glucose and blood sugar level, and reducing the inflammations of the. Just you can understand with this how beautiful this medicines can work for our diabetic patients, for our hypertensive patients, if it is prescribed in totality understanding. Then next hormone that is related is the FSH, that is follicle stimulating hormone. Follicle stimulating hormone, it produces a sperm in people assigned male at birth. FSH also stimulates the ovary in female to produce estrogen and play a role in egg development in people assigned female at birth. This is known as the gonadotropic hormone. So the both of the hormone, ACTH and FSH, both of the hormones are very much important, essential parts, and we must, and it is totally based on your understanding about the life. And then another glands are the growth hormone, that is known as the GH. In children, growth hormone stimulates the growth. In other words, it helps children to grow taller. In adults, growth hormone helps maintain healthy muscles and bone and impacts fat distribution. And growth hormone also impacts your metabolism. Then another hormone that you can relate it to it is luteinizing hormone, that is LH. LH stimulates ovulations in people, assigned female at birth, and testosterone production in people assigned male in birth at birth. LH is also known as gonadotropic hormone because of this role play in controlling the function of ovary and testis, known as the gonadotrop. Then next is the prolactin. It stimulates your breast milk productions, lactations after giving birth. It can affect fertility and sexual function in the. So all these hormones are available in both male and female, but their responsibility is dependent on the nature of the mind of the male, individual male, and of the individual female. Then another hormone is TSH hormone. TSH stimulates your thyroid to produce thyroid hormone that manages your metabolism, energy level, and your nervousness. The posterior lobe of the pituitary gland stores and releases the following hormones, but thalamus makes them possible. So, antidiuretic hormone, that is called ADH or vasopressin. This hormone regulates the water balance and sodium level in the body. Then oxytocin, hypothalamus makes oxytocin and your pituitary gland store and release it. In people assigned female at birth, oxytocin helps in labor to progress during childbirth by sending signals to their uterus to contract. It also causes breast milk to flow and influence the bonding between parents and the baby. In people assigned male at birth, oxytocin plays a role in moving the sperm. Now, life without pituitary gland. Suppose you don't have the pituitary gland, then what will happen? One can live without pituitary gland as long as they have to take medications to replace the pituitary hormone that they are missing. So lifelong will have to take if there is no pituitary gland is damaged or not available. The pituitary gland hormones are very important for maintaining almost all functions of your body. An untreated lack of the pituitary hormone is a life-threatening element. The action is, now in summarize, to action: the growth, metabolism, reproductions, response to stress or trauma, lactations, water and sodium balance, labor, and the childbirth. Then thermostat. It is a thermostat that maintains a temperature in your body. That constant temperature check in home to keep the you comfortable. It sends signal to heating and cooling system to turn up or down a certain number of degrees to keep air temperature. So we as a human beings, we have we can survive in different climate, cold weather, hot weather, but in every time our temperature is regulated at the 95 degree, 96 or 97 degrees Fahrenheit. So this is important things. Thermostat, it maintains why your temperature remains static, only because your pituitary glands is functioning well. Otherwise, your fever condition, the chronic fever, chronicity in the fever, low grade fever, both the things are representative that you are. Suppose a person is taking too much sensitive to the cold, then that means your pituitary gland is also affected. If the patient is suffering from the hot, every time they are affected. So hot and cold patients, they brings a very important understanding, and you have to think about the thermostat conditions of the body. Interactions between hypothalamus and pituitary gland. This is very important because both are situated in the same place, and they form a hypothalamus pituitary complex that serves as brain central command center to control the vital functions of the body. And then hypothalamus is the part of the brain that is in charge of some of body's basic operations. It sends message to autonomic nervous system, which controls things like blood pressure, heart rate, and breathing. Hypothalamus also tells pituitary gland to produce and release hormones that affects other area of the body. Then pituitary glands connected with the hypothalamus through a stalk of blood vessels and nerves that is known as the pituitary stalk. So those that stalk hypothalamus through that stalk hypothalamus communicates with the anterior pituitary lobe via hormone and the posterior lobe through nervous impulse. Then hypothalamus also creates oxytocin, antidiuretic hormone, and tells posterior pituitary when to store and release these hormones. So I have already, again to summarize, the hypothalamus makes the following hormones to communicate with the other hormones with the pituitary gland. That is the corticotropin release hormone, CRH, dopamine, then gonadotropin release hormone, then growth hormone release hormone, somatostatin, and thyrotropic release hormones. Medical conditions related to the pituitary gland. If there is either the excess or the diminish of the pituitary functions, there causes conditions known as the pituitary conditions. Pituitary conditions are often caused by growth in hormone glands. These causes hormone problems. These masses are usually not cancerous. They only causes problems when they change hormones level or take up too much spaces. Other causes of pituitary conditions can include surgery, radiation therapy, infections or trauma in the head. Problem with hypothalamus can also cause a pituitary condition. Now, this another word, prolactinoma, is a benign mass tumor on pituitary gland that makes prolactin. Prolactinomas causes prolactinemia, too much prolactin in the blood. So, in the female, you will find notice their period becoming lighter and stopping, having difficulty getting pregnant, and then start lactating, that is the production of the milk. So, if this is disturbed, so this in the male, difficulty in getting erections, reduced libido, infertility, and enlarged breast. Hypopituitarism, hypo means diminished is when pituitary gland does not make enough or more, one or more of the pituitary hormone. This in turn affects hormones produced by other glands in the body. The signs and symptoms can appear very slowly. They also vary from person to person. Then growth hormone deficiency, it will brings the tumor, then damage your pituitary glands and abnormal development of the pituitary. It can delay children's functions, growth, and lead to the child being shorter in height than expected. So growth hormone related symptoms are tiredness, weak muscles and the bone, excess weight, anxiety, mood problems, and so. So these are the symptoms when the deficiency is there. And these symptoms also you can think about when you are trying to think about the finding the in a patient these type of the conditions. So I'm making an analogical understanding about the relationship between the symptoms as well as the deficiency that can be created by the hormones. Other pituitary hormones conditions are rare pituitary conditions. These are gingitism. Gingitism means the growth is too much. Then acromegaly, where you have too much growth and your hands, feet, and faces are larger. One asymmetrical growth. That Cushing syndrome, when your body creates too much cortisol due to mass in the pituitary, making too much ACTH. Then another vision problem, loss of peripheral vision, headache, hormonal imbalance from pituitary hormone excess or deficiency, a lack of growth or excess growth in children, male and female sterility, infertility or sterility, irregular periods, unexplained weight gain or weight loss, and depressions and anxiety. So pituitary is a tiny but powerful gland since it is responsible for several different hormones that affects many aspects of your body and health. It can be difficult to pinpoint if certain symptoms are a result of tissue with your pituitary glands or something else. If you are have ever experienced new or over concerning symptoms, it is important to talk to your healthcare provider. They can usually run simple tests to assess your health. Now, pituitine as a homeopathic medicines, uh, because I told you there are not so much symptoms available. Only the therapeutic applied aspects are available. On that basis, you can think about the exercises a superior control over the growth, and the same language is there of the sexual organ, stimulates muscular activity, overcomes uterine inertia. Its influence over unstriped muscular fiber is marked. Cerebral hemorrhage will check hemorrhage and add absorptions or clot. Then uterine inertia in second stage of the lever, that is fully dilated. And then high blood pressure, chronic nephritis, prostatitis. The 10 drops after milk, that is mentioned by Dr. Geo Fuller. Vertigo difficult, and you can get a better result. Vertigo difficult, mental concentration, confusion, fullness, deep in frontal region, I use 30th potency. Now, then another important understanding is pituitary exercise is a superior control over the growth and development of your sexual organ, stimulate muscular activity and overcomes uterine inertia. It influences over unstriped muscles fiber is marked. Cerebral hemorrhage during the old age, this is very prominent. We'll check hemorrhage and add absorptions of the clot. Uterine inertia is in second stage of the liver where it is fully dilated. High blood pressure, chronic nephritis or prostatitis, vertigo, difficult mental concentration, confusion, and fullness deep in the frontal region. During pregnancy and before and after the menses, the gland is enlarged in certain cases. The enlarged glands before and during menstruation period is attended with menstrual headache. Some patients get the menstruation headache during the menstrual period. This is usually relieved by the administration of this remedy. And pituitary head have been cured by this whole gland. In the stout women and amenorrhea of this type of headache is usually relieved by this medicine along with the thyroidinum. It is also effective in menorrhagia and the metorrhagia. It is serviceable in heart failure and in shock when blood pressure is very low. It should be thought of following practitioner after the birth or the lactotomy when the urinary blood is semi-paralyzed. Incontinence of the urine, both in adult and the children, it has been a great service. Also the nocturnal urinalysis, like the bedwetting. It is in the fatigue syndrome, asthenia with weakness and neuromuscular pain. Also after parturition, when the mother remains weak, does not gain her strength, and the uterus does not contract normally and exact, the whole gland is useful. By the term whole gland, I mean to say the potentized medicines of the pituitary. Then it should be thought of in epilepsy cases, especially in young children and youth. Well, it should be studied in connection with the thyroid and parathyroid. The whole gland should be used. Extract of the anterior lobe uh, should be thought in the reflex. Extract of the posterior lobe should be used in the diabetes. So the two type of the hormones uh, you have to find it out. The extract coming from the anterior lobe and extract coming from the posterior lobe, and both will have the differently. But usually in the market, you do not find this type of the extract, that is separate extracts. It helps in reducing the inflammation of prostate glands and also regulating the urinations. It also aids blood pressure level and helps in reducing the vertigo with the nausea. So now, how it is related? It is a vasoconstrictor and parturient, used chiefly for its action on the uterus, either in childbirth or to check bleeding after the delivery. In dosage with 1 ccm intravenously it to stimulate liver pain. This is the allopathic applications. Expulsive period only. Contraindication is myocarditis, nephritis, and arteriosclerosis. A watery solution made from the posterior portions of the gland is put up in ampoules containing about 15 minimum of it, and is considered the hypodermic solution. No side effect as per the also. So a case study, now this is another important by the Rohit Mathur, who conducted a case study. And this case study reconfirms the association between the increased frequency of headache and pituitary hormone among cases with the lactotropha adenoma. Then it also suggests that individualized homeopathic treatment may be helpful in pituitary adenomas with increased risk of complications such as intracellular hemorrhage. So there is a message from Jnana Mandal: be like pituitary glands, be the master of all. Size does not matter, but most importantly, do follow your supreme master, that is the hypothalamus. So who is the supreme master? Your own life. So you have to follow your life. So thank you for your active listening, and I think I can have tried to explain you some aspect of the pituitary gland. Thank you very much. So friends, what the purpose of learning this Sarcodes is not that you can get the entire symptoms, because there are very paucity of the symptoms, uh, direct symptoms available from the Meta. If you try to find it out from the Meta Medica or the repertory, it may not be possible for you to prescribe the nosodes or the Sarcodes. But you have to apply the mind aspects and to construct a totality on that applied mind and the objective symptoms and objective understanding, you can create a better use of the nosodes and the Sarcodes medicine. So with this, I conclude my session now, and thank you all for having a active listening. Thank you very much.